So for our amalgam procedures, we are going to start off using a mouth mirror, which allows indirect vision by the dentist and reflects light onto the surfaces. Then we are going to use the Explorer, which is used to examine teeth for the presence of cavities. Next is the Spoon Excavator, which is used to remove carious dentin. Then it is the Enamel Hatchet, which is used for removing enamel and dentin on teeth. Then we have the mesial GMT and the distal GMT, which is the mesial is used to create bevels on the medial cervical margin of the preparation, and the distal is used for the distal cervical margin of the preparation. And then we have the small condenser and the large condenser. And those are used to pack and condense amalgam into interproximal areas of cavity preparations. It's just two different sizes. Then this is the Acorn Burnisher. It is used to smooth amalgam after condensing and performing initial shaping of the amalgam. It is also used to contour matrix bands before placement. This one is the Tanner Carver, which is used to carve occlusal anatomy into the restorations. And this is the half Hollenbeck Carver to contour and carve occlusal and interproximal anatomy and the other restorative and temporary filling materials, as well as amalgam restorations. And then here we have our articulating paper holder, and then the articulating paper, as well as a cotton tip. And the holder is used to hold the articulating paper in place and check for lateral occlusion. And then the articulating paper is used to highlight occlusal contacts. And then next we have the burr block, as well as the burrs inside of it. The burr block is just used to hold all of the burrs in. And then we have the wedges, which are used to hold the matrix band in place along the gingival margins of class 2, 3, and 5 preparations. And then we have the Troffelmeyer, which is used for class 2 restorations, and it holds and maintains stability for the matrix band. And then we have our die-cal, the liner applicator, and the mixing pad. Die-cal is used as a liner, and the mixing pad is used to mix the die-cal to get the reaction and material that we want to place into the tooth. Then the liner applicator is used to place it in the area that they want on the tooth. Next we have our 2x2 gauze, our cotton rolls, and our amalgam capsules. The 2x2 gauze can be used for isolation as well as the cotton rolls. You can use the 2x2 gauze to clean off a specific area that is needed. And the amalgam capsules, they are the amalgam that you're going to put in the tooth. Okay, and then our anesthetic aspirating syringe is used to administer a local anesthetic, as well as the holder. Okay, and then over here we have the air water syringe tips. And we also have the saliva ejector and the HBE. The saliva ejector is used to suck up saliva, and then the HBE you can use to keep the area free of debris and it can be used to suck up saliva to keep the area dry. The air-water tips can be used to rinse and dry specific areas or the entire oral cavity. And then we have our scissors here, which are used for cutting and trimming areas that are needed. The well for the amalgam, it's used to hold the amalgam before it is placed and also to hold amalgam while loading the carrier. We have our cotton pliers or cotton forceps, the locking and the non-locking, which are used to grasp and transfer items or material into and out of the oral cavity. Then we have our mouth mirror, which it allows indirect vision, reflects light onto surfaces. Then our amalgam carrier, which is used to carry and dispense amalgam into the cavity preparation. And we have our slow speed motor and our contra angle, which is used with a burr for intraoral and extraoral procedures to remove decay and refine cavity preparation. We also have our high-speed handpiece. It is used to cut tooth structure, bone, and remove tooth decay. And we also have our triturator to mix the alloy and mercury into amalgam in a capsule. And that is our amalgam procedure setup.